Two health workers are among 16 people diagnosed with coronavirus in New South Wales. The latest patient is an 82-year-old aged care resident from the same Sydney home where a 95-year-old woman died from a respiratory illness not confirmed to be COVID-19. A university lecturer from nearby Macquarie University also has the disease, but the uni says they did not have contact with any other staff or students. The Federal Health Minister has confirmed he expects the number of people with the disease to rise.
They're society's most vulnerable, the elderly and the sick, exposed across two locations in Sydney to the potentially deadly COVID-19 virus. An aged care nurse working in Macquarie Park in the city's northwest tested positive on Monday. She fell ill last week. Hers is the third human-to-human transmission of the virus in the country.
This much-loved staff member had not travelled. She had not been overseas. She had not been to any of the hotspots.
The woman who worked at Dorothy Henderson Lodge for more than 2 decades has had contact with 13 patients. 11 are isolated and 2 have undergone testing.
One of those was a 95-year-old lady who has passed away. Now, whether or not it was related to corona, we don't know at this point.
Health authorities are confident the virus has been contained within the premises. The nurse is undergoing treatment at Royal North Shore Hospital and is in a stable condition. A doctor from Ryde Hospital is also in isolation with COVID-19. Some of his patients and dozens of his colleagues also put into quarantine.
So across the country, there are real challenges, but what we are doing is making sure that we are prepared, and as we have seen, wherever these cases have emerged, we are responding.
Health authorities are trying to figure out who they contracted the virus from and whether it's possible cases have gone under the radar.
It is concerning when we have somebody present with coronavirus and we can't track the source.
There are more than a dozen cases of COVID-19 here in New South Wales, and almost every one of these cases is linked to a coronavirus hotspot overseas. Travel bans remain in place for China and Iran.
The single most important message I want to get out to return travellers that if you become unwell at all in any way, immediately isolate and with respiratory symptoms and get help. And that's really, really important.
The powers are there, the compliance has been there, but we will not hesitate either through the states or, if required, the Commonwealth to enforce if necessary.
Stella Todorovic, Sky News.
Darwin has confirmed its first case of coronavirus outside of those brought to the territory for quarantine. Australia's Chief Medical Officer has also warned people in remote communities are most at risk from a potential coronavirus outbreak.
As coronavirus cases in Australia rise, a stark warning from our Chief Medical Officer.
Probably the biggest single concern is trying to keep the disease out of communities, particularly non-metropolitan communities.
Brendan Murphy says Australia's cities and towns are well equipped to deal with coronavirus, but it's a different story in more remote parts of the country, where the nearest hospital might be hundreds of kilometres away.
In isolated communities, this infection could have pretty devastating consequences.
Of particular concern are remote Indigenous communities already dealing with high rates of chronic illness, including diabetes and rheumatic heart disease. Authorities are concerned fly-in, fly-out resources workers could bring the disease in with them.
They present a particular risk, and so we're planning a range of different approaches to staffing and screening of people coming into communities.
The Northern Territory's Aboriginal Affairs Minister says the situation is being monitored closely.
People are concerned. They're seeing a lot of media, of course, getting a lot of up-to-date information.
But there are also concerns about the spread of misinformation, particularly on social media.
I'm very concerned about it because we have over 100 Aboriginal languages in the Northern Territory, and already there is a great deal of fear amongst those Aboriginal communities.
There are still more than 150 people being held here at Howard Springs, about 30 kilometres from the Darwin CBD, but they'll finally get to go home early on Thursday morning after spending 14 days in quarantine. Matt Cunningham, Sky News, Darwin.